Okay, and so in this anatomical session, we're going to cover some of the bony landmarks that you'll need to identify as a student at the knee. And we're also going to talk about some of the musculature that's associated with movement of the knee. So if you've got a patient at home and you can identify some of these things, do follow along. And we're going to start on the front of the knee, which is known in professional terminology as the anterior aspect. On that anterior aspect, we have a bone that some of you are likely to be familiar with already, and that is this kneecap, which we call the patella. So if you draw that on, you'll find the base, which is at the top, and then that tracks round on the lateral border, and then the medial border, so our medial border being the one on the inside of the body, our lateral border being the one on the outside of the body. That then reaches its apex, which is the point where the medial and lateral border meet. On that apex, we can then palpate the patellar tendon. So there will be a soft tissue that sits just below the apex of the patella, and that moves inferiorly and then reattaches into this point here, which is called the tibial tuberosity. And a lot of you will be able to palpate that because it will be a prominent bony landmark that you feel just below the patella. And this is the tendon that we see inserting from the quadriceps itself. So if I straighten your patient's knee out, if where you've got the base of the patella, you draw a few lines on the top of that, that is where your quadriceps tendon is placed. Now into the quadriceps tendon is our quadricep muscles. So we have 4 quadriceps. We have the rectus femoris, which is the most superficial, the one that's on the top, that runs directly down the front and middle of the knee. We then have 3 vastus muscles. We have a vastus muscle that sits on the inside, and if we get your patient to contract the knee down into the couch, we can see this teardrop looking muscle on the inside of the knee. Okay, so this is our vastus medialis. On the opposite side to that, if we get the patient to contract their knee into the couch again, we can see this muscle that's on the lateral side, and that is our vastus lateralis. Now we said earlier that there was this muscle that ran down the middle in this region, and that is our rectus femoris. But if we were to dissect the muscles and we took that layer off, underneath the rectus femoris we have a muscle called the vastus intermedialis. So it's in between our lateralis and our medialis and sits underneath the rectus femoris. So we've got a few bony landmarks in and around the patella, and then we have a few muscles on the anterior aspect of the upper leg. Join us on the open day for more.
Okay, so this is just a short session on kinesiology taping. So in your envelope you should have received 2 pieces of pre-cut K-tape. So K-tape claims to reduce pain in clients, so that's what I'm going to be showing you a taping technique for, amongst other things that it does claim to do, such as improving range of movement when someone needs to be rehabilitated. So for this one we're going to imagine that our client has got pain across the wrist, so the wrist joint here that provides flexion and extension, as well as ulnar deviation and radial deviation. So our 2 pieces of tape in at the end will lie one across the arm in that way and one across the wrist like this. So this tape has got some backing paper on, the white tape, the white side of the paper, sorry, and then you can rip the backing paper off, the white bit, to expose the sticky adhesive on the pink side. So we're going to start here on the back of the hand, and that bit there that you've just peeled off, which is about 1 square's width, is going to lay on the back of the hand, and you're just going to place that down under what we'd say no tension, because this tape does stretch. So if I lay that down with no tension on it at all, So from here, I'm going to want to keep a hold of that when I stretch it all towards the elbow joint. So at the elbow joint here, you've got two bony prominences called the lateral and medial epicondyles. So when you're up the top here, so where that elbow joint, when we're flexing and extending the elbow, if you feel for two bony prominences, one on one side and one on the other, and when you've found the one that is on the outside of your client, that's the direction that you're going to put your tape in. So here you've still got your backing paper. If you just peel that off, but not all the way, leave another square's width at the end. Hold on to the back of the hand, and then you're going to stretch it to its full stretch, and then come back just slightly, so you're roughly stretching it to about 75%. Then lay that down with your hand until you get to that lateral epicondyle. You're then going to release the tension, peel the tape off the back completely, and then lay the rest down, so this bit that's across the back of my hand, under no tension. It doesn't matter where that piece of tape goes to, because that's having no effect on the muscles that are on the back, this side of the arm. So that's your first bit of tape. You can rub it down to make sure it's stuck properly. You're then going to take your smaller bit of tape. This one you're going to break right in the middle, so it's 2 squares width. Break it in the middle and peel. Don't peel them off completely, just peel one to each side. And you should be holding it in this way. So you've got to stretch in the middle. This one you're going to place across that joint, the wrist joint there. So you're going to stretch it to 100% this time. You're going to lie that down in the middle, and then let go of the two ends. So one end, which is on her thumb side on my client, so I'm going to push that down. And then on the other side, which you'll see, just peel it off and lay that down under no tension. You can either rub it with the backing paper to set the adhesive, or you could just rub it with your hand there, and that should, where those two lie, should relieve the pain in that region there. You'll learn more about the anatomical language that we might utilise in the course to provide this taping technique on the applicant holder day.
So in the massage session, what we're going to cover is the 3 techniques you'll learn in a class and you'll learn on the applicant day. So these are effleurage, petrissage, depotement. So effleurage is more smooth stroking techniques, petrissage is the kneading technique, and then depotement's the one we all want to do. So first of all, I'll show you effleurage. So what you'll need is your client lay face down with their face in a face hole, or just put cushions either side so they can breathe, that always helps. Get some lotion or body lotion or some massage oil, rub it, get plenty in your hands, rub your hands together, and then we're going to stand at the head end. And what you're going to do, just to spread the lotion on, put yourself in a lunge position, hands on, this might be a little bit cold, hands on, and we're just going to go all the way down the back to make sure the full back is covered in lotion. You're going to repeat this pattern a few times just to make sure the body's getting a little bit warmer. Once you've done it for the full back, we're going to go on to one half of the back. So I'm just going to go onto this right side, again get a bit more lotion if you need it, and we're going to stand again in this lunge position. So for effleurage, we're going to do those stroking techniques and find a nice rhythm. This can be slow or a little bit quicker, however you feel like the body is responding. Once you've done that, so you've gone from a full back where you spread all the lotion around, we're going to spend a bit of time on the half, and then we're going to go into the quarter. We'll go into each detail a little bit more on the day. So what you can do at the top is do some petrissage, so that's that kneading motion. So if I show you this side, this upper neck back area is what most people end up with a lot of tightness, especially at the moment working at home on all sorts of odd shaped desks and everything else people are doing. So you're going to grab this muscle and then just knead it. So what I'm doing is lifting the muscle up. So in a kneading motion, you want to be doing a reasonable amount of pressure to be able to lift the muscle off where it is. And the patient generally shouldn't feel any pain with this. It should feel quite a nice movement, so have a practice. Usually for things like this, you can get plenty of volunteers. Once you've warmed the area up, move on to the other side. Once this area is complete and the massage of effleurage and petrissage are complete, you can do something called depotement. So for this, it's usually used to warm up a sports person up before they go maybe on the pitch, if it's a footballer, just before a game. And what you're going to do, there's 2 techniques. So you can either do straight hands and do like a chopping motion, or you can put your hands in like an OK sign and do a cupping motion. So if I do that, so I've just got my thumb and index finger together, and what I'm going to do is go into a slight squat position, and from this lower back area here, I'm just going to up and down the muscle. And I'd spend a few minutes doing that. We'll cover how to do that over more of the muscles later on. And then at the end of every session, what you want to be doing is going back to them nice effleurage techniques to help the muscles relax after a massage, and so the client knows the session's over.